Well, first of all, and I think this, not necessarily the first time, but any surgery, you've got to be ready for the recovery. That's the hardest part of any cosmetic surgery. So what that means is commit to the recovery. Make sure that you have help at home. Most women have children, when they're having a tummy tuck or mommy makeover, and so we don't want you lifting anything for about 6 to 8 weeks. That includes mostly your children and other things. So you've got to have someone to help you, number one. You've got to be ready to take time off work and from your normal routine to really let your body recover. It's typically, we have problems when we start trying to push it too soon. We start trying to get back to our activities because we have to sometimes. And so those are the people who tend to have problems, unfortunately.
Yeah, but recovery is normal with any type of procedure.
Yeah, you just got to commit to the recovery.
How do you determine the right surgical approach based on a patient's individual needs and goals?
That's a good question. So one, a physical exam is very helpful. So we can really see kind of, a lot of women say, I just have a lot of fullness in my middle abdomen, and that's not really fat. A lot of times that's just where you have separation of your muscle and the internal or abdominal content is kind of pushing or bulging out. That's going to be restored and repaired with a tummy tuck because we're going to replace those muscles or restore those muscles to the right position. And so it's kind of like a corset. Think about it coming together. It's not going to allow that to bulge out as much. So really finding the problem with an exam, like I said, and then working towards achieving what their goals are. Also, finding out what the goals are is important because if someone has unrealistic goals or expectations, that's something they need to wrap their mind around before surgery so they're not going to be unhappy after. It's important to understand.
You're also very honest with your patients.
I try to be.
So it's good to be that way. You always want an honest surgeon.
Yeah.
How long do the results of a tummy tuck typically last, and what can patients do to maintain them?
So that's another good question because like everyone's body, with or without a tummy tuck, time is going to have an impact on our bodies. So gravity is going to pull skin down. Yeah. We're going to gain weight as our metabolism slows down, as we become less active later in life. And so what you can do to minimize the progression of these natural occurring things is to be healthy, eat healthy, exercise, make sure that you're in a good place mentally as well as important. You want to be, full everything about your body optimized so that you can really enjoy your results and make them last as long as they can.
How soon after can someone go to the gym?
So assuming everything's healing well, there's no small complications like wounds or anything like that. Most often you can get back in about 6 weeks.
Well,
yeah, it's not bad.
Not bad.
The hard part about it is that, let me rephrase that. That's with the tummy tuck specific. If you've had breast surgery, I don't like you doing any chest or workouts until about 3 months, once the implants have settled. But with a tummy tuck, the hardest part is going to be the core. You're going to have really tight abdomen and they're going to be a little bit sore. So getting back into it where you might have done 50 sit-ups before surgery, now you're only going to do 10 and you're going to feel the same amount of kind of fatigue. And so you've got to be patient and gradually get back to where you were, and you'll get past where you were even further.
Okay, awesome. And the last patient that one of our viewers asked is, how does a tummy tuck contribute to a patient's overall body contouring and confidence?
Yeah, so I kind of mentioned it before, but a tummy tuck is really the cherry on top. So if you've lost weight, you're kind of in a good, healthy position to where you're ready to really finally get the contour that you've been working towards. That's when you're ready for it. So getting your weight in the right kind of BMI category and focusing on getting the weight down to where you want to be, it's just going to kind of finalize what you've been working towards. Same with massive weight loss patients, obese patients who have lost that weight. Now we can restore the body to kind of reward them for all the work they've done through surgery, working out, and maintaining a healthy lifestyle. But the reason tummy tucks are probably my favorite surgery is because you can see the confidence change in a person the next day after surgery. Liposuction, oftentimes you look great after surgery, but you're still swollen. You're not going to see those final results until 3 to 6 months after surgery, once all that swelling comes down. But the drastic change you see with the tummy tuck is really impressive, and patients love to see it right away, and they can tell they've made the right decision. They're thrilled with the results.
Especially for you as their surgeon. All right, so thank you for answering these questions. You also have a ton of promotions right now with all of your procedures.
Yeah, I just saw it.
So if you want a tummy tuck or a mommy makeover, come here and see the tummy tuck god, Dr. McDaniel. And make sure you book your appointment. So again, thank you so much for being here with us. And we'll see you guys next time. Bye.